The Nigeria Center for Disease Control is set to declare a state of emergency on cholera outbreak in Nigeria. Well, the agency says it has recorded 1,298 cases from 31 states and 31 deaths from week 1, January 1 to week 24, June 15, that's this month. While the director, acting head of department, Health Emergency Preparedness and Response, Nigeria Center for Disease Control, revealed this exclusively to Arise News. He said Bayelsa is highest with 442, Lagos 350, Abia 109, Zamfara 64, Bauchi 46, Cross River 42, Ebonyi 38, Delta 34, Katsina 34, Imo 28, Nasarawa has 19, Ondo 17, Kano 13, Niger 11, and Osun 11. Well, the NCDC had earlier reported the outbreak of cholera with 65 confirmed cases, 1,141 suspected cases, and 30 deaths from 30 states. You might say one from each state. Well, joining me now to discuss more on the outbreak of cholera in Nigeria is Dr. Ginga Joseph, the acting head of department, Health Emergency Preparedness and Response at the Nigeria Center for Disease Control, NCDC. Thank you so much for joining us on Newsnight. I mean, there's no better person to help us understand what's happening with cholera outbreak in Nigeria and, very importantly, your state of preparedness. I mean, you are the Emergency Preparedness and Response Department. How bad, really, is this situation that we should be gearing up for a state of emergency?
Thank you for having me. The state of the cholera outbreak in Nigeria is not bad.
Okay.
Everything is still under control.
Right.
At the end of every outbreak, we usually take stocks, trying to identify the best practice, what are the gaps, and what are the things that need to be done in order to strengthen the systems so that we can improve our capacities and capability to respond to outbreaks of cholera. After the last year outbreaks, we tried to use the gap identified and then the coping capacity that we have to develop preparedness actions. As we all know, outbreaks will not happen. There is no outbreak that is called national outbreaks. Most of the outbreaks occurs at the community levels or at the state levels. So we tried to support the subnational, the state levels, to prepare what we call preparedness actions.
What are those?
So there are activities that we have identified to help in preventions and controls of cholera outbreaks. And it's supporting that because of the mandate of NCDC to protect the health of Nigerians and ensure that every public health event are perfectly prevented and controlled in order to ensure that we have healthy citizens in Nigeria.
Great.
One of the things that we have done is to be able to support them, how to be able to respond to these outbreaks by building workforce at the subnational levels.
Okay.
Through the support of one of our projects, we are able to send funds to all the states to ensure that they strengthen their surveillance systems, ensure that they be able to identify and detect cholera cases so that can be timely response. And again, we also support them to be able to build capacities of the workforce that we call rapid response team, even at the local government level.
These measures that you talk about, brilliant measures, do you put them in place before these outbreaks happen, or it's when the outbreak occurs that you then begin to, pool resources together to, push back on this outbreak?
So we have a risk calendars that help us to be able to predict when there will be possible outbreaks of cholera. We pull like 5 years data to be able to predict what are the possible time we can have outbreaks of cholera. Because there are thresholds that we also monitor using our robust surveillance system across the state. So what we usually do is that we work based on the risk calendars. And the risk calendars suggested to us that by April, May, we start having cases of cholera.
Right.
So before that, we have developed the preparedness actions, and we have been following that preparedness action to ensure that we strengthen the infrastructure at the state level so that we can build up the capacities, improve the capability to be able to respond when we have cholera outbreaks.
Let me take you up on the issue of, you did mention that based on past experience, you look at the gaps, where the gaps are, and try to, close up or cover those gaps. Where exactly are the, gaps, for want of a better expression? Where are the challenges?
So when you look at choleras and you look at the drivers, of cholera, you have open defecations, and then you have contaminated waters, and then you have climate change, and then the infrastructure to be able to respond. Maybe there is some weak in the gap in terms of capacity to respond. So what we have been able to do, because this is the Center for Disease Controls and Preventions, what we try to do is to ensure that we strengthen our surveillance system to be able to identify those cases in a timely manner and be able to respond. And apart from that, we are able to also train our workforce to be able to support the response.
So you've been able to do that now with this outbreak in 31 states out of 36, and you're already telling us this is an emergency situation that's brewing. What exactly are the specifics? Because there are concerns now that our schools, especially because the children are very vulnerable. What are you doing in that direction to ensure that children and young people, young Nigerians, are not, more vulnerable than they should be?
So we have sent the advisory note to the states to help the states to be able to put some of those preventive measures in place. And one of the things is to help them to be able to understand some of the basic measures they need to put in place.
Great.
One of those basic measures we need to put in place as Nigerians is hand washing, hand washing, hand washing.
Great.
When you wash your hand before eating and after eating, when you wash your hand after toilet, or you toss a contaminated substance. Then food hygiene. Make sure that you actually prepare your food very well, and then boil your food. And most of the time, we encourage that you heat your food when it is warm.
Do you have public enlightenment going on in the markets? Take Mile 12, for example, in Lagos. Maybe on Igbo market, still in Lagos. Markets here in Abuja, day-day market. Is there public enlightenment going on in those places? Because you buy your carrot, your cucumber, if you're fan of salads. You buy tomatoes. Unfortunately, there's not much tomatoes to buy in the markets. But, are you carrying out public enlightenment in those places? Because those areas are really where, you breed cholera, I believe.
So that's one of the good things that we have been able to achieve.
Great.
We have been able to ensure that apart from supporting the state to be able to have creating awareness in the market, creating awareness in the schools, we have tried to ensure that we have a robust committees at the community level, just to be able to ensure that we use the community structures to reach out to the communities, to provide them some of these basic measures that they need to take in order to prevent cholera outbreak within their localities. And one of those things we have been able to do very well is to be able to ensure that we have clusters of communities, and then the local government education officers have been trained, and then they provide those messages to those communities, ensuring that we build the community trust for them to be able to take some of these simple measures to prevent cholera within their communities. And that is one of the preparedness measures we have put in place to be able to ensure that we educate the people at the grassroots.
Great.
As we are talking, because cholera response is a collaborative measures, multi-sectorial in approach, we have been able to engage other sectors to be able to support this preventive method. Ministry of Environment, they are also part of it. Ministry of Water Resources, they are also doing their own best. And everybody come together to be able to support the response of cholera in Nigeria.
So what you're saying, there is no cause for alarm, but quickly, what situation can lead to a state of emergency being declared? How likely is that to happen?
So when we talk about
when
we talk about the state of emergency, we try to monitor the threshold. Looking at the cholera response in Nigeria, we have gained substantial experience in order to respond. But we know that the numbers that we count in terms of death, they are human beings. And we are trying as much as possible to reduce the case fatality rate below 1%, which is the global standard. And that's what we are trying to do. Now, currently, our case fatality rate is 2.4. We need to ensure that we bring down the case fatality rate to 1%. That is why, with all the effort we have put in place, we are on top of the game, and we are so sure that we can control and prevent the cholera outbreak in Nigeria. So every Nigerian to be free, and then to just relax.
Take precautions, wash your hands, and wash your hands again. Dr. Ginga Joseph, Acting Head of Department Health, Emergency Preparedness and Response, NCDC. Thank you very much for joining us on Newsnight.